Good morning, everyone, and thank you for joining us today for this briefing on public safety issues. We're going to start off talking about traffic safety with Yang Tao, who's our city traffic engineer, and the person who's spearheading our Vision Zero initiative to reduce traffic-related fatalities. Yang will be followed by Madison Police Chief Sean Barnes, and then by Madison Fire Department Assistant Chief for Medical Affairs, Chase Stedman. And then I will have a few words to say, and we'll take questions at the end. So we'll start with Yang Tao.
Thank you, Mayor. Good morning, everyone. As you all know, a couple of years ago, Mayor Sacha started our Vision Zero initiative. So since that, we have been working on envisioning how we approach transportation safety in our community. It has been a team effort and has been a very collaborative one. It involves many city agencies, such as the Mayor's Office, traffic engineering, the police department, public health, fire department, engineering, fleet, and many other city agencies. We also have seen a lot of really good participation from our communities, from our appointed officials, elected officials, and many stakeholders. So together, we made a lot of progress. We have been keeping you updated, and today we want to bring you some updates, for what happened in the last few months. As you may know, that earlier this year, we completed our first Vision Zero action plan. So it's a comprehensive plan, kind of provides a roadmap for our work. It ranges from safe streets, safe people, safe vehicles, safety data, and also safety-focused enforcement. So it provides a complete plan for us to follow, and it also set up a really good opportunity for us to pursue some of the new federal funding that I'm going to talk about a little bit later. It's a first plan for a city. It's a first plan in Wisconsin. And the mayor actually has a really good blog on this, I think back in May. So if you're interested, please check out that wonderful blog on the action plan. We have also been working with our transportation committees on redesigning our infrastructure programs. We integrated many different programs into one new program called Safe Streets Madison. So really trying to prioritize safety, using data, prioritize equity, and also pay attention, especially to the safety of our most vulnerable users, such as pedestrians and bicyclists. So we are keep rolling out infrastructure projects through that program, and you have seen many that's coming, including some of the speed reduction projects that you have seen on East Washington Avenue, and also on John Drive, and many more is coming. We are also providing a much more enhanced community engagement throughout the year. For example. You may heard about our Let's Talk Streets program. So we go to the communities that we serve and find out what they think about our street, what improvements they think we should make, for safety and for other good reasons, such as for sustainability. And we're going to different neighborhoods, attending neighborhood events, capitalizing on that, such as the current Parks Alive event, and also the past Safety Saturday events. So really trying to engage our residents to hear their inputs, to learn about their need, and also trying to foster a safety culture. And in the city here, we are changing our design philosophy and also operations philosophy. We really start to refuse to take fatality as a price to pay for mobility. Everyone starts to believe that even one death is too many. And we're trying to get down to zero. We also believe that humans make mistakes, but the consequences shouldn't be fatalities or some injury that change, the person's life forever or their family's life forever. And our work has been recognized nationally by different organizations, including U.S. DOT, National League of Cities. We'll also be speaking at the upcoming National Association of City Transportation Officials annual meeting in Boston in September. So people know that we're serious about this. And we are pursuing and leveraging federal safety grants. We already received 3 grants, which are smaller, and now we're working on a major grant for the U.S. DOT's new safety Safe Streets for All program. And we're looking at somewhere around a $20 million application for that. So hopefully we can bring more resources to our community, helping us to improve safety. I'm also going to share some data with you, showing that our progress in improving traffic safety. So the first set of data is citywide. So these are preliminary data, and this compares what we are doing for the first half of this year with the first half of last year. So the graph on the left shows the total number of crashes. And you can see that the total number of crashes just reduced a little bit, not too much. It was down 5%. However, on the right hand, it shows the total number of fatalities and serious injuries. And you can see that we reduced fatalities and serious injuries significantly by 40%. And that's the whole idea about behind Vision Zero, right? And we know humans are going to make mistakes. So, we cannot prevent all the crashes, but we can make a difference in the outcome of those crashes. And as you all know that, one of the main corridors, East Washington Avenue, has been getting a lot of attention in the recent years, for safety reasons. So we compiled some data for East Washington Avenue. So again, if you look at the total number of crashes, it didn't change that much. Actually, it increased a little bit, about 6%. However, the total number of fatalities and serious injuries down significantly by 33%. Especially, I want to point out that the first half of last year, we had 3 fatalities. This year, we had none. So we hope to continue that trend. And finally, I want to finish by saying that safety starts with all of us. It's really a job for all of us in the community, and Vision Zero requires a comprehensive and collaborative approach. So our daily choices really matter, especially when we get behind the wheel. So let's work together. Let's achieve there. Thank you.
Good morning, everyone. Thank you, Madam Mayor. The Madison Police Department, for the first time in our modern history, have crafted a vision statement for public safety here in Madison. The Madison Police Department will be the national model for exceptional policing through our commitment to selfless public service, effective community partnerships, and evidence-based policing practices. For over 30 years, policing professionals have evaluated the effectiveness of crime reduction strategies, including our very own Herman Goldstein, and have shown that strategies which are strategically focused and data-driven are the most effective. Our approach to crime reduction strategy in Madison includes community policing, problem-oriented policing, hotspot policing, and monthly accountability meetings, all while using a team city approach. We track our efforts daily and apply intelligence-led policing using data and analytics to guide our patrol officers, detectives, and investigators in these efforts. This year, our summer strategic plan focused on gun crimes, shots fired, stolen autos, and traffic accidents. Our command staff and our public identified these crimes as top priorities for our police department. We chose to once again create a summer strategic plan because our data sets demonstrate that warm weather months create the greatest opportunities for these crimes to flourish. This year, our strategic plan will run from June 1st through October 31st. The following is a comparative analysis for June 1 through August 15th, and then we'll show you a much larger data set for some of our traffic accidents. It's important to note that we still have 6 months left in this plan. The first chart I want to share with you is our homicides for this part of our strategic plan. Again, June 1 through August 15th. As you can see, compared to the previous years of 2019 during the same time period, 0, 5 in 2020, 5 in 2021, and only 3 in 2022. The horizontal line represents the 3-year average. I've always said it's better to compare to a bigger data set than simply just looking year to date. So as you can see, we're certainly trending in the right direction, although any loss of life in our community is a great loss for us all. Shots fired. This represents, I think, citizens' increased fear of crime, and so we are certainly looking at a place-based approach to shots fired. As you can see from this chart, we're trending in the right direction. The horizontal line, again, represents the 3-year average. In 2019, during the same time period that we're working on, we had 36, 2020, we had 92, 2021, 48, and 2022, 41. So we are trending in the right direction. There's a lot of work to do on this particular point, but we certainly are focused on shots fired, and we're glad to see that we're trending in the right direction. Subjects struck by gunfire, we are even in this time period with last year, but if you look at the 3-year average, you'll see we're just below the 3-year average. So with our subjects who are actually struck by gunfire, you will see that we are trending again in the right direction in regards to violent crime. Stolen auto. Stolen autos represents really our biggest challenge right now. I do think we were trending in the right direction, and then we realized other law enforcement agencies realized, we all did, that there was a defect in 2 models, the Kia and the Hyundai. And so if you were to aggregate and leave out the Kias and Hyundai, you would see that we would be below, well below the 3-year average. I did do some research late last night or early in the morning hours and found that in October, Hyundai will be doing recalls on their vehicles in order to fix that program. We've also partnered with the Kia brand to give us some vehicle locks, sometimes known as the club, in order to defeat those who may want to take these vehicles. But I do believe we were definitely trending in the right direction until this vehicle defect was discovered. Crashes with fatalities, this same time period, as you can see, we're well below the 3-year average, with only having 3 so far during this time period of our strategic plan. So we are focusing in on East Washington Street, Mineral Point Road, as well as the Beltline. And so we know there's always work to do. We're still in your neighborhoods. Every time I say that, people say, well, that's great, but what about my neighborhood? We still have officers who are patrolling and doing traffic in other areas, but we do know that these areas represent what we call our high injury network. And we know that if we focus in on these efforts, we'll have a reduction, and we're seeing that right now. Last but not least is the crashes with injuries. As you can see, year to date, we're still below the 3-year average. And, you know, that's really credit to the Vision Zero campaign and all the education and work that they have done and our ability to partner with them. I mentioned before the Team City approach. I will tell you that you probably will not find a better example of that than Vision Zero. And so we're certainly appreciative of all the work with that. And I think we're certainly headed in the right direction. Again, our violent crime is decreasing. It's definitely trending in the right direction. We still have some more work to do on that, but I think we're headed in the right direction. We still have work to do in regards to our stolen cars. We're always seeking ways to improve the effectiveness and efficiency of our police department. We have implemented new strategies to address crime and disorder in Madison, and we're holding ourselves accountable. But we need the community's help. Please call us early in any disorder. Remember to lock your cars and close your garage doors. Most importantly, never attempt to disarm anyone and or break up any disturbance beyond your level of training. I think that together, working with your police department, we can return Madison to the city we all know and love. We're doing good work together. We're headed in the right direction. We're using a Team City approach. I would like to thank, really, there's so many people I want to thank for helping us with this initiative, including our public health unit, who helps us tremendously with different meetings, in the mayor's office for her support of our efforts. So thank you very much.
Good morning, everyone. Thank you for having me, Mayor. My name is Che Stedman. I'm the Assistant Chief of Medical Affairs with the Madison Fire Department, and I oversee the paramedics that work for the city's crisis response team. Before I get into my slides, I think it's important to note that the City of Madison Fire Department does not run the CARES team, our crisis response team. It's a true multi-agency cooperation and coordination between Dane County Human Services, Madison-Dane County Public Health, Journey Mental Health, Madison Police Department, UW Police Department, Capitol Police Department, and a lot of community mental health providers. So this is a lot of folks in our community and city government working hard to make sure that the folks that are having mental health challenges out there are getting the services they need. So in 2021, we launched the crisis response team, or CARES team. It's Community Alternative Response Emergency Services. And the real point of this team was to address nonviolent behavioral health emergencies in the city of Madison that were typically responded to by law enforcement. When we looked around the country at best practices in regard to behavioral health and mental health response, we found that one of the most patient-centered models out there was to send a paramedic with a trained crisis worker. And so in partnership with Dane County Human Services and Journey Mental Health, we have a team that includes a paramedic and a trained crisis worker that responds to 911 calls. When we launched in September of 21, we're ensuring that not only medical and behavioral health care is integrated from the onset, but the mental health component and being able to assess folks where they are in the right place at the right time is incredibly important. And it also it helps to divert folks from jails and hospitals when necessary. So since CARES has started in September of 2021, we've responded to 850 incidents. The goal of a CARES response really depends on the situation. Each response is unique and focuses on the patient. We are there to de-escalate, provide on-scene intervention and assessments, and when needed, the important piece is to be able to refer patients to services in the community that are right for them. And so our CARES team is not only able to provide those services right away in a 911 situation, but they're able to drive folks to where they need to be to provide what we call a warm handoff and make sure that these patients that need help are getting taken to the right providers in the community. And you can see a short list here of providers that we have been working with. And so how does this improve services in Madison, right? You know, when we connect patients in that timely way and respond with a paramedic and a crisis worker, we understand that the community oftentimes does not like to see somebody with a badge and a gun walk through their door when they're experiencing a behavioral health emergency. Now, I know that our Madison police officers are well trained and do their jobs well, but their job is law enforcement. And when we can come through into a situation and provide a de-escalation and assessment situation where a person is more comfortable with the care that's being given and is able to be referred to and driven to services, it makes their patient satisfaction and long-term care better according to best practices around the country. So just some stats for you. To date, 18% of the 850 folks that we have seen have been referred or connected to acute emergency services. That's something that was needed in the moment right now, acute emergency services. 40% of these folks have been connected or reconnected to stable services, including case management services and other non-emergency services such as inpatient, outpatient, residential, detox services, whatever it is that they need. Just want to say the last thing is this is a 911 service. So if you need cares, you call 911 and the Dane County 911 Center will triage that call to you appropriately and take care of the needs that you have. Thank you.
Thank you, everyone, for those presentations. It's really good to hear about all the work that Team City is doing in our community to improve safety. Everyone in Madison deserves to feel safe in their home, their neighborhood, and their community. And if we're going to get serious about tackling violence, and we are serious about tackling violence, we need to be tough in responding to crime as it happens, and at the same time, take a comprehensive approach to be tough on the root causes of crime. Madison is one of the safest cities in the nation, and as you've seen, many of our statistics are trending in the right direction. Shots fired incidents are down this year compared to last year. But let me be clear, any level of gun violence in our community is unacceptable. Chief Barnes, as you've heard, has taken the whole police department through a strategic planning process that resulted in those three top priorities: shots fired calls, stolen auto incidents, and hazardous driving. He has public meetings in each police district to take public comment and input to shaping the strategic planning. He's also commissioned a long-range strategic plan covering 5 to 7 years. And I fully support the work and the efforts of the chief and his team to take this approach to addressing serious issues in our community. I'm particularly happy that Chief Barnes is investing in a data-informed analysis, and I was pleased to fund a new position, a Data Reform and Innovation Director, in my last budget that will work closely with the chief to make sure that our efforts are data-informed going forward. It's a high-level position. We'll deploy a criminologist to help us ensure that officers are going where they're needed most. It will help us reduce over-policing and racial disparities and focus on the things that really matter in our community. But MPD can't do this work alone. And a lot of our work has been making it possible for the police department to focus on law enforcement, which is their specialty and where their attention should be. We need help across the board to make sure that we can shift some of the burden off of law enforcement. And in particular, we need the help of our partners in the state and federal government to keep guns out of the hands of people who commit crimes. We can't do this alone at the local level. The rise in violent crime across the country is fueled by easy access to guns in our communities. We need common sense gun safety laws, including stronger background checks, red flag laws, cracking down on illegal guns, and we need to ban assault weapons from our streets. We also need to be just as aggressive in our focus on the root causes of crime and violence. We need to use every tool in our toolbox to prevent crime and to improve safety, including investing in mental health response like the CARES team, violence prevention, through our Office of Violence Prevention in Public Health, Youth Employment, and Affordable Housing. As you heard, in September of last year, we fielded the new 911 emergency response team, Madison Cares, that pairs the crisis worker with a paramedic to respond to nonviolent calls for behavioral health emergencies instead of the police. Again, we want to take some of the burden off of the police department so they can focus on the violent crimes and shots fired. And so far this year, I think CARES has been very successful. They've responded, as you heard, to over 850 calls. And it's already clear from the data that we're collecting that they've been very effective at connecting people to the needed behavioral health services that the patients in these incidents need. Again, it's a very patient-focused approach and one that I think our community really deserves. Every year, our city focuses on funding summer youth employment programs. We usually spend about $900,000. This past few years, we've been supercharging those programs with about $700,000 additional dollars thanks to the federal ARPA funding that President Biden and Congress approved. These funds help our young people gain important work skills and keep them gainfully occupied over the summer. And of course, our public health department has a violence prevention team that funds community groups doing much needed work. And they are building programs to help mediate and prevent violence in the community. This team will be expanding this year with new hires to help prevent crime downtown and to help mediate more conflicts across our community. To me, it's very important that we take a public health approach to reducing violence. That's based on evidence from across the country and around the world. And again, we're looking at being driven by evidence and by data in our approach to violence. In the bigger picture, the city works hard on key elements of safe, secure communities, including affordable housing and economic security. These are the things that are at the root of violence prevention in the long term. And since I have been in office, I have increased our affordable housing fund by 64%, and we will include additional funds in next year's budget. We invest significant funding into economic development for historically marginalized entrepreneurs and businesses to help build wealth in our community, particularly in communities of color. We've also launched the Madison Forward Fund to promote economic security for our most vulnerable families and build the evidence base for a guaranteed income project at the federal level. As you've heard today, all of us in the city are working hard to stop the violence, hold people accountable for their actions, and invest in positive solutions. Our approach is working, but we must continue our efforts, and we need our entire community to join us in creating a culture of safety and keeping Madison a place where everyone has the opportunity to thrive. Thank you again for tuning in today, and we'll see if we have any questions for any of our speakers. All right. Thank you again to everyone who presented, and thanks for tuning in. Have a great day.